Good morning. This is Dr. Megan Reel. I am a clinical health psychologist practicing at the University of Michigan in our GI behavioral health program. I am a faculty member in the GI division and work very closely with my colleagues to provide patients with a variety of behavioral interventions to help manage their GI conditions. Today, I am here to talk to you a little bit about some strategies to help cope with COVID. Together with colleagues from around the world, we're doing a Coping with COVID series, which can be found on Twitter under the hashtag Monday Night IBD. And so this just serves as something to utilize when you begin to notice some of the emotions that are coming up and are very real when you're on the wards or when you're at home with your family. So I'm speaking to my physician and nurse and medical assistant, anyone that's really in the hospitals on the front line, but also to your loved ones or essentially anyone in the world that is affected by this pandemic that's going on and that's certainly creating uncertainty and fear. But there's also other things that it's bringing up. It's bringing up senses of community and in some capacity, a new level of hope for kindness that we can provide to each other. And I'm really privileged and honored to be a part of this series because we have psychologists from literally around the world speaking different languages of strategy and compassion for everyone that is dealing with the effects of COVID and some of the uncertainty that's going to be happening in the next couple of days and weeks. So my colleague, Dr. Tiffany Taft out of Chicago, spoke yesterday on the Coping with COVID series about grief and loss. And I would highly encourage you to check out her about 10-minute YouTube piece on that, which gave some really insightful and practical strategies to help observe and recognize some of the aspects of grief and loss that all of us are likely enduring right now, and then some things that in a really healthy way can help us to begin to process that grief and loss. Today, what I wanted to share with you is a strategy that comes from principles of acceptance and commitment-based therapy, or ACT. And Russ Harris is a psychologist that speaks a lot about concepts having to do with calming emotional storms. And I know that myself, as a mom and a psychologist and a friend, I'm wearing a lot of different hats right now. And so sometimes when I take one hat off and put on another one, I can feel some of the emotion that comes with that. Sometimes it's worry, sometimes it's anxiety. As I've been saying, there's also some aspects of feeling hope and joy when I see my community coming together and supporting one another. So with that kind of comes this ebb and flow of emotions. And this strategy in particular is for some of those more difficult emotions. So anger and sadness, grief, and anxiety. And we can feel it oftentimes. We can feel the thoughts kind of catastrophizing, or at this point, even some of our thoughts that maybe at one point would have been considered catastrophizing are actually real. Worry about your safety when you go to your workplace. What it's like to go and have a really difficult conversation with a family member of a patient that is not doing well. And since we don't have a lot of human contact with patients' family members, that conversation might actually have to take place over the phone. And so I really want to encourage my colleagues to acknowledge and be kind to the various emotions that you are experiencing and enduring in your workday. And then those emotions, even when you're on your way to work or coming home. Many people have never had to fear going to work and then possibly bringing this illness into your home, to your loved ones. And so our brains are thinking in ways that most of us have not had to think about. And again, with that, at times, and especially if you're exhausted, it's harder to combat some of these thoughts that can kind of rage in our mind and lead to higher levels of anxiety and stress and fear and grief. And so, calming an emotional storm, again, is a technique that is described by Russ Harris and in the ACT literature. And a lot of this idea of using ACT is to acknowledge the emotions and recognize when we're having them, recognize the effect that they can have on our body, and then using some tools and strategies to calm down those emotional storms that we can have when we're inundated by a pandemic. And so, for the next couple of minutes here, what I'd like to do is give you a bit of a script that hopefully you can refer back to when and if you need it, or maybe you need to use it right now. But the beautiful thing about having a strategy like this, and which really kind of acknowledges the emotions, but then comes back into the body, looking at what can you kind of calm and bring attention to within yourself in that moment. So a lot of coming back into a mindful place of accepting the present moment. And the thing about mindfulness is that accepting the present moment sometimes is not a positive experience, or the moment may be a very difficult one for you. But the more we can kind of anchor into the present moment and stop some of the thoughts that might be way up into the future, whether that future be in an hour from now, or in a day from now, or in a week, if we can get you back into what's real and true, what are you managing, what are you dealing with in this present moment, that can be a very beneficial skill. And so this strategy of anchoring you to help calm an emotional storm is one that I've been using. It's been something I've been teaching my patients that I'm seeing each day. And I certainly hope that my friends and loved ones that are on the front lines can find some time and space to practice this, because we know that you are experiencing a lot from an emotional perspective. And that emotional perspective then can take a toll on the body. And at a time when we need our immune systems as strong as we can get them, we are very hopeful that these psychological interventions will be very helpful for all of you out there. So what I'd like you to do at this time is just kind of prepare to do a brief intervention with me. And like I said, you can use this in the future, or maybe you want to just take some time and acknowledge what your thoughts are right now, check in with yourself, and we'll see if this is something that you find beneficial. So you can start by silently and kindly acknowledging to yourself what your emotions are. And we can pretend in your mind, or again, if you're following along and have some stronger emotions, perhaps you're feeling hurt or fearful. Maybe your anxiety is really revving at a level that's making your thoughts wander a lot. And as you give yourself some time to just silently and kindly accept what these emotions are, hurt or pain, just give yourself some time and space to do this. You can then start to anchor yourself by pushing your feet into the floor. So really feeling what it feels like to have your toes anchor in, your heels Just push your feet very hard into the floor. Start to straighten your back. And if you're sitting, maybe you sit forward in your chair. Or if you're standing, you can do this at work. Maybe you're in a hallway and you can just go anchor your body up against a wall to feel what it feels like to have your back touch the wall. You can start to press your fingertips together or stretch your arms out. Just paying attention to the body, maybe shrugging your shoulders. And you can start to acknowledge the painful thoughts and the feelings are present. Acknowledge thoughts of anxiety or fear, that they are present and they are real. Also notice that there is a body around those feelings, a body that you have control over, a body that you can move. So just notice right now your whole body. Notice what it is doing. Notice your hands, your feet, your back. Just stretching that body. Really pressing the feet down and grounding yourself. And then you can start to look around the space that you're in, and you're going to just start to find about 5 things that you can see. And then you'll also notice 3 or 4 things that you can hear. And it doesn't matter what those things are. Depending on the level of worry and anxiety that you're feeling, you may even be able to hear your heartbeat or feel your heartbeat. You might hear other people. You might hear the shuffling of papers or beeping. And then notice what you are doing. Just notice the space, what you are doing in that moment. And it might be that you're standing there calming your emotional storm. You're anchoring yourself. You're dropping anchor. And then notice again that there are, again, anxious thoughts or feelings. Maybe there are memories that are also present in that moment with you. Noticing yourself again wherever you're at. Are you standing someplace or are you in a chair? Notice your body in that space and begin to move it again. So stretch, maybe take some deep breaths. Place your feet firmly on the ground, noticing what that feels like in your body. And then again, noticing that there's a room around you, wherever that room is, wherever that space is. Again, whether it be you're at work or you're at home, you're in your car before you head back into your house to see your loved ones. You've had a hard day, and so you're trying to calm the body and the mind. And then you'll just come back into whatever you're doing, fully engaging in the task or activity or job that you have to go back to. And so in this way, as you return back to the present moment, to the task that is at hand, it doesn't mean that what's happening before you is not any less difficult. It doesn't change what you're about to have to go do or how you're going to approach things. But what a task and an intervention like this can do is it brings you back to the present moment instead of the swirling that can happen during an emotional storm. And so it may help you to be more of a calm in the midst of the storm that's happening. And so that's something that I know that I use mindfulness to practice, that I know that there are people that are struggling tremendously right now, or people that are on the front lines that have been sick or are terrified that they will get sick. And so, if I can offer some tools and strategies and connect with my other colleagues that are a part of this series, we really hope to kind of come together because we are stronger together. And so I encourage you to continue to follow along with us on the hashtag coping with COVID, and that today's exercise will be something that you can practice and get better and better at. In essence, a lot of what I just went through, this very kind of practice, should be practiced over and over, and you might even have to go through it a couple times in one sitting, just to feel like you've calmed your emotional storm, you've dropped anchor, and you feel ready to get back to the task at hand. So don't feel like this is a one and done intervention. This is certainly something that will take time and practice. So I am going to end for the day, and I wish that you and your family are well. And coming to you from Ann Arbor, Michigan, take care.